Hey doc, are your CPAP intolerant obstructive sleep apnea patients going untreated? And if so, what is the solution? I'm Dr. Rene Piedra, and I want to thank you for allowing me just 3 minutes of your time. I think that by way of a short video, we can save ourselves valuable clinical time. 90% of your obstructive sleep apnea patients are going undiagnosed. And of those that have been diagnosed, just actually over 50% of them cannot tolerate a CPAP. So what is the solution? What do you do? As you know, there is ample evidence and white papers which demonstrate the impact of uncontrolled sleep apnea on morbidities or comorbidities such as hypertension, CVAs, insulin intolerance, impotence, GERD, reflux, things such as depression, even neurocognitive and social effects, motor vehicle accidents, increased morbidity, even increased mortality. None of your CPAP intolerant patients should be going untreated. So what do you do? What the American Academy of Sleep Medicine and their standards and guidelines recommend is that when a patient is intolerant to CPAP, they be placed on oral appliance therapy. What is an oral appliance? Well, an oral appliance is a device that the patient places on their teeth before they go to sleep. And what it does is it repositions the jaw so that when they doze off and they lose muscle tone, their soft tissues don't collapse and obstruct their airway. Now, taking compliance into consideration, a CPAP is the most efficacious treatment for the treatment of obstructive sleep apnea. However, oral appliance therapy is the most effective treatment for obstructive sleep apnea. That's what we do. That is actually my passion. Now, I've never had a patient tell me, Dr. Piedra, that is the most beautiful three-surface filling I've ever seen in my life. In the 22 years that I've been practicing, I've never had that happen. However, on a daily basis, I do have patients thanking me for bringing their obstructive sleep apnea under control for various reasons. That is my passion. That is what we do. We actually use one of 28 different types of oral appliances depending on various factors. And if ever you have a question on what we do or how we do it, I would be more than happy to go over that with you. It's actually quite interesting. I'm proud and humbled to say that I am the only diplomate of the American Board of Dental Sleep Medicine and the only diplomate of the American Board of Craniofacial Dental Sleep Medicine in Miami. If your CPAP intolerant patient needs to be treated, and believe me they do, please refer them over. I always report back to my referring physicians. I always report on the patient's progress. Also, if you suspect that one of your patients may have obstructive sleep apnea, feel free to refer them as well. We do have, as part of our team, sleep physicians that take care of testing the patient, scoring the tests, and who work shoulder to shoulder with me on bringing the patient's obstructive sleep apnea under control. Thank you for allowing me this brief time to get this message across to you. I look forward to helping you get your patient back to optimal health, bringing them quality of life and longevity. Thanks again. Make it a great day.